So this is going to be insulin administration. First, you're going to need to take your blood sugar, and for this we're going to say that my patient's blood sugar is 175. So according to the sliding scale, he's going to need 2 units of insulin. So to do this, we're going to go ahead and have to withdraw our insulin. We're going to take the cap off of the insulin. We're going to disinfect. Then we're going to get our insulin needle ready. We're going to draw back for the 2 units. Insert some air in there, and then withdraw the 2 units of insulin. Before you administer, you're going to want to check your insulin with another nurse. You're not going to want to tell them how much you're drawing up so they can tell for themselves.
2 units.
Alright. So, now, we're going to get ready to actually give the insulin to the patient. You do hand hygiene. You go ahead and put on gloves. You're going to want to choose your site for this activity. We're going to say that the patient wants it in their abdomen, so we're going to give it in the abdomen. You're going to want to find out if it was given in the abdomen, which side it was given, because you're going to want to rotate sites. But when you go ahead and give it, you're going to want to disinfect, and then you're going to take your insulin, bevel up, and administer at a 45-degree angle into the subcutaneous tissue. Inject and pull it out. Alright, and then you would put the sharps in the sharps container. And so now you would, or for this I'm going to mention the different places that you would give insulin. You want to give it subcutaneously, so you could give it in the back of the arm, you could give it in the abdomen, as long as you make sure you rotate sites. You could give it in the anterior thigh. As for where you want to give it, as long as you rotate sites, usually it's patient preference is the biggest thing. When you document, you're going to want to document what kind of insulin you gave, the amount of insulin you gave, where you gave it, and then the route you gave it, usually subcutaneously. And I think that's about it.